Hello, Stonites. Welcome back to LFI Educate. Well, in the previous chapter, we have all learned about the psychological disorders, and today in this video, we are going to learn chapter 5. In this chapter 5, which is therapeutic approaches, we will be briefly discussing some of the major forms of psychotherapy. In this video, the topics which we are going to discuss will be nature and process of psychotherapy. In this nature and process of psychotherapy, we will be studying a little bit about the therapeutic relationship between the client and the therapies. Then the types of therapies. Under these types of therapies, there are lots of therapies, but we will be focusing on behavior therapy and its techniques and cognitive therapy. Here, we will be emphasizing on rational emotive therapy and cognitive behavioral therapy. Then comes humanistic existential therapy. Under this, we will be studying logotherapy, client-centered therapy, and gestalt therapy. Then the last therapy will be the alternative therapies. Here, we will be emphasizing on yoga and meditation. Then the last topic for today will be the rehabilitation of the mentally ill. So each of this topic, we will be discussing one after the other in the next slide. Well, let us discuss about the nature and process of psychotherapy. But before we discuss further about the nature and process of psychotherapy, let us first try to understand what is psychotherapy. Well, in short, psychotherapy means a kind of a voluntary relationship that shares between the client and the therapist. Or in other words, it is a type of relationship that takes place between the one seeking for help and the one who is going to help. So the main purpose of psychotherapy is to help the client solve their problems or maybe solve their different types of psychological problems that faced by him or her in day-to-day life activities. So normally it says that psychotherapy functions under the therapeutic relationship where the trust between the client and the therapist plays the core foundation, because the therapist needs to accept the client just as they are and need not be judgmental in any circumstances. And also, above all, the therapist need to show unconditional positive regard to the client so that the client will also feel accepted. So the main aim of psychotherapy is to reinforce the client for betterment, modify their habits, increase self-awareness in them, and help the client to change their thinking pattern, maybe from negative thinking to positive thinking, or maybe it can be even said as irrational belief to rational thinking. So the therapist is expected to be a certified one, or the therapists are expected to be a certified or a trained professional in the concerned field in order to achieve an effective therapeutic outcome. Therapeutic relationship. As discussed in the earlier slides, when I say about the therapeutic relationship, it is a special relationship that's shared between the client and the therapist. So in this therapeutic relationship, we have some components to discuss. The first one is the contractual nature of relationship. Here it talks about the legal relationship that shares between two or more parties who agree to work together to achieve one common goal. So the client and the therapist, they come to a certain condition in order to work together. Then the second one is the limited duration of therapy. The duration of therapy refers to how long it can be, or like how many days, weeks, months, or even years a client should be treated with, like following the manual method for any given problem. Then the third one is the maintain confidentiality. Confidentiality is central to the development of trust between the client and the therapist. So all the things discussed in a session needs to be kept confidential unless and until there is a compelling reason to break the confidentiality just for the benefit of the client. But most of the time, whatever discussed in the session are being kept confidential. Then the last one is building the trust. Building trust is another important key feature between the client and the therapist. Unless there is trust, the session cannot be successful. And to build this trust, it really takes hard work. So these are some of the key components that comes under the therapeutic relationship between the client and the therapist. From now on, we will be discussing about the different types of therapies. So the first one is the behavioral therapy. So this behavioral therapy assumes that psychological distress takes place mainly because of the faulty behavior. So this therapy focuses on the behavior and the thought patterns of the client's present life. No doubt, the therapist also focus on the past life of the client, but just to find out or to identify how and when such faulty behavior arises or begins in client's life. So when the therapist identify what are the causes that makes the client to behave or to change his or her behavior, some of the reasons are mainly because of the faulty conditioning patterns like negative thoughts and belief system that can affect one's behavior, or after identifying these the causes of change, the methods involved in this behavioral therapy are like the therapist will start analyzing the behavior by identifying the malfunctioning behavior, antecedent factors, and the different types of factors that keeps maintaining for the change that takes place in client's behavior. So here this malfunctioning behavior are those type of behavior which are very unacceptable, and the antecedent factors are those events or the situations that makes the person to behave in such faulty nature or faulty behavior. So once this faulty behavior is identified, then a treatment package is chosen. So behavior therapy consists of a large set of specific techniques and intervention, and one particular technique cannot be applied to the other person because it depends upon the differences of human personality. So the symptoms, once the symptoms of the client and the clinical diagnosis are identified, depending on it, the techniques or maybe the different types of intervention can be applied to the particular client. So the behavior therapist does this through the following operations. The first one is the antecedent operations, the second one is the establishing operations, and the third one is the consequent operations. So this antecedent operations means this controls behavior by changing something that causes distress. Then establishing operation means this refers to the change which can be achieved by increasing or decreasing the reinforcing value of a particular consequences. And the last one is the consequent operation. It is praising the client by the therapist in a particular settings whenever he or she performs better in a given task or a given responsibility. So the duration of this behavioral therapy or the treatment falls for a few months. Well, this is still the continuation of the behavioral therapy which we have discussed in the earlier slide, but in this slide we will be discussing about the techniques. So the first one is the negative reinforcement. It refers to the following an undesired response with an outcome which is very painful or not liked by the client. For example, the teacher punished a child for disturbing in the classroom. So this is known as negative reinforcement. Then second one is aversive conditioning. It refers to repeated association of undesired response with an aversive consequences. For example, an alcoholic is given a kind of a mild electric shock and asked to smell the alcohol. So with this repeated pairing of the smell of alcohol with the aversive painful electric shock, the person will give up drinking. Then comes positive reinforcement. This positive reinforcement is given to increase the deficit behavior in a child. So in order to push up a child, if a child does not do his homework regularly, we can introduce positive reinforcement by promising the child, like if he or she does the homework on time, he or she will be rewarded. Then comes token economy. Person with behavioral problem can be given token as a reward every time a wanted behavior occurs. So the token, each time he or she does good, a token will be given to him or her, and this token will be collected and exchanged at the end, and therefore exchange in the form of a reward. And like reward can be like promising him or her, or like taking her for an outing. Okay, so this comes in the form of a token economy. Then differential reinforcement is like unwanted behavior can be reduced and wanted behavior can be increased simultaneously through differential reinforcement, which means positive reinforcement for the wanted behavior and negative reinforcement for the unwanted behavior attempted. So these two can be attempted together in one particular method known as differential reinforcement. Then comes systematic desensitization. This systematic desensitization is a kind of a technique introduced to treat the phobias or irrational fear in the life of a client. So the therapist will prepare a kind of a hierarchy of anxiety-provoking stimuli with the least fearful at the bottom to the most fearful at the top. Then in that particular hierarchy. Then over the session, the client is able to imagine more severe fear-provoking situations while maintaining the relaxation. So the client will get an opportunity to overcome systematically or desensitize his or her fear. Then the last one is the modeling. Modeling is a kind of a procedure where the client will start behaving in a certain way by observing the behavior of a person to whom he or she considered to be the role model. So all this comes under the techniques that comes under the behavioral therapy. So this negative reinforcement, aversive conditioning, positive reinforcement, token economy, differential reinforcement, systematic desensitization, and modeling are all considered as the behavioral techniques. Cognitive therapy. The first one is the rational emotive therapy by Albert Ellis. So in this slide, we will be discussing about the rational emotive therapy, which was introduced by Albert Ellis. And according to this rational emotive therapy, it considers that it has more in common with the therapies that are oriented towards our human cognition and our behavior. So this approach is based on the assumption that our human cognitive thinking, our ability, our feelings and emotions, and our behavior are all very much interconnected. They interact significantly and therefore have a reciprocal cause and effect relationship. So it is all about the irrational belief that mediate between the antecedent events and its consequences. So RET, which is also known as rational emotive therapy, also assume that human feelings and emotions stem mainly from our belief system, from the way we think, our attitude, and our reaction to a given life situation. So whenever we talk about rational emotive therapy, it is very important to know about the theory of personality analysis, which is known as ABC technique. So this ABC, A stands for activating event, B stands for belief, and C stands for consequences. So this, when I talk about ABC, let me put a simple example where a person, a student, he or she didn't study throughout the year and could not prepare well during the exam, and he or she could not make it. Okay, he fell in the exam or she failed in the exam. So with this, the failing in the exam becomes an activating event, a discouraging moment for him or her. Then that will affect his belief system. So now the belief system will be the person will start thinking that he or she is good for nothing and I'm not capable of anything. So started to develop all the negative thoughts, all the irrational belief about himself or herself. Then this will lead to C, that is going to affect his or her behavior. The consequences will be he or she started to have a kind of a faulty behavior, like started relying more towards substance dependence and many more. So these ABC are very much interrelated with one another. So with all this rational emotive therapy, in this therapy, the therapist will help the client to change their irrational belief, okay, by making a change in his or her understanding about the philosophy of life. So according to Albert Ellis, he believes that human being, many a time, we mainly feel the way according to what we think. Cognitive behavior therapy. So this cognitive behavior therapy is a psychosocial intervention that aims to improve mental health. So this therapy is a very short one, a very comprehensive and very effective treatment for a wide range of psychological disorder such as anxiety disorder, depression, panic attacks, and borderline personality disorder. So this CBT is therefore considered as a type of psychotherapy. It helps us to change our unhelpful or unhealthy ways of thinking, feeling, and behavior. The therapy also addresses the biological aspects of life, or like whenever we go through any problem from in biological aspects of life, we get healing with the help of relaxation postures, or whenever there is any psychological problem, there is like a therapy with the help of behavior and cognitive therapy, and social aspects can be taken care with the help of environmental manipulations. So thus CBT normally uses self-help strategies and thus improves our quality of life. For example, like we all learn ourselves to manage our stress and anxiety by overcoming our cognitive distortions. Humanistic existential therapy. According to this therapy, it emphasizes that psychological distress arises from the feeling of being loneliness or alienation or incongruence between real self and idol self. Here, real self means the person who we really are, and the idol self is someone or what we imagine ourselves to be. So when this real self and idol self have huge imbalances, that is the moment when we become very distressful. So meaninglessness in life leads to emptiness and hollowness, or a condition often known as existential vacuum. As like there is no such things in this world which are kept ready for our survival, but rather we have to create our own meaning in life. But when things doesn't work according to what we plan, many a time we start questioning for our own existence. So this therapy is best considered as an invitation to the clients to recognize the ways in which they are not living fully authentic lives, and therefore to make choices that will lead to their becoming of what they are capable of. So healing occurs when the client is able to perceive the obstacles to self-actualization in his or her life and therefore able to remove them completely. So in this existential therapy, like the therapies between the therapist and the client, the therapist will start creating a kind of atmosphere where there will be like no judgmental and accepting the client just as they are, and creating a kind of a environment where the client will freely express their emotion. So according to this therapy, the client will initiate the process of self-growth through which healing will take place. So this comes under the humanistic existential therapy. Logotherapy by Viktor Frankl. So according to this therapy, it talks about logo means it's all about a treatment for soul. So this therapy involves the process of finding meaning even in life-threatening circumstances. The therapy also focuses more on here and now, and the therapist helps the client to remember or keeps reminding about the immediacy of the present life. This logotherapy, according to Viktor Frankl, he introduced this therapy basing on his own life experiences in Nazi concentration camp, where he lost his own brother, parents, wife, and children. So he vividly remembered his horrible experiences in life, but he was able to use all these experiences in a very constructive way, and he did not allow all the horrible experiences in life to dampen his love and enthusiasm for life. So this therapy talks about even in the worst situations of our life and even in the worst circumstances, we have a choice to make in life. And thus this therapy talks about the essence of human being lies in searching for meaning and purpose in life. And we can discover this meaning through our actions, by experiencing a value, and also through suffering. So the main goal of this therapy is to make all the client understand the true meaning and responsibility of life, irrespective of the circumstances they face in life. Client-centered therapy by Carl Roger. According to this client-centered therapy, this therapy is based on the concept from Humanistic psychology, and it shares many concepts and values with the existential perspective. This therapy talks about the concept of self and freedom and choices as the core of one's being. Carl Roger also have an assumption that we human beings, we are essentially trustworthy and that we have a potential to understand ourselves and resolve our own problem by ourselves. And therefore, he introduced this client-centered therapy where the main central importance was given to the phenomenological world of the client alone. So, according to this therapy, it provides a warm relationship in which the client can reconnect with his or her disintegrated feelings, and the therapists continue to show empathy, unconditional positive regard to the client, and throughout the session, the therapists remain non-judgmental towards the client feeling, and therefore keep on reflecting the client's feeling by rephrasing the statement of the client. As a result of which, this therapy focuses on this importance of the client, where the main focus of the therapy was on the nature of becoming the self that one truly is. Now let us talk about the last therapy that comes under the existential therapy, and that is Gestalt therapy. It was introduced by Frederick and his wife Laura Burl. According to this therapy, it is a purely existential and phenomenological approach based on the premises that individuals must be understood in the context of their ongoing relationship with the environment where they belong to. So the initial call or the initial motive of this therapy is to help the client to increase their individual self-awareness and self-acceptance. The moment an individual experiences this self-awareness and self-acceptance, then the changes takes place automatically. And also, according to this therapy, it focuses on the client's perceptions of reality and existential, because it is grounded in the notion that people are always in the process of becoming, remaking, and rediscovering oneself. So this therapy allows the client to recognize the bodily processes and the emotions that are being blocked out from awareness. The therapies in this Gestalt therapy encourages the client to act out fantasies about the feelings and the conflicts they go through. One of the therapist's role in this Gestalt therapy is the device experiments designed to increase client self-awareness of what they are doing and how they are doing it. And also, the therapy is based on a here and now experiencing that is always changing. So, this Gestalt therapy is not only applicable to individual counseling alone, but it can be even used in a group setting as well. Alternative therapies. In these alternative therapies, we will be discussing about the yoga and the meditation. So when we talk about yoga, yoga is an ancient Indian technique titled in the Ashtanga Yoga of Patanjali's Yoga Sutras. It also refers to the asanas, the body posture component, or the pranayama breathing practices. So in short, yoga is considered as one of the tools that deals with the transformation and stabilization of mind. It has lots of mental health benefits. Several recent studies also have suggested that yoga helps in strengthening our social attachment, reduces stress, and relieve anxiety, depression, and insomnia. So proper training by a skilled teacher or a trainer and 30 minutes practice every day maximizes the benefits. Then when we talk about meditation, it refers to the practice of focusing our attention on breath or an object or thought of a mantra. So meditation is a mental exercise that trains our attention and awareness with a purpose to curb one's negative thoughts, emotions, and feelings. So with this, we come to the end of our definition about the yoga and the meditation in short, and in the next slide we will be discussing about the different types of yoga. Sudarshana Kriya Yoga. It is a unique breathing practice that involves cyclical breathing patterns that range from slow and calming to rapid and stimulating. These rapid breathing techniques have lots of positive impact in our immune system, nerves, and psychological problems like post-traumatic stress disorder in survivors of mass disasters, reduces depression, and also reduces stress. Kundalini Yoga. It is a magical science that uses sound, mantra, energy healing, exercise, and meditation to release trauma from the energetic body which surrounds our physical body. It is very effective in treating mental disorders and obsessive compulsive disorder. It combines pranayama breathing techniques with chanting of mantras. Then comes Vipassana meditation. It is an observation-based, self-exploratory journey that focuses on deep interconnection between our mind and the body, which is released through disciplined attention to the physical sensation. So it is also known as the mindfulness-based meditation with no fixed object or thought to hold to attention. So this Vipassana meditation is also very helpful in overcoming depression. In this slide, we will be discussing about the rehabilitation of mentally ill. So when we talk about the treatment of psychological disorders, it has two components. So when we talk about the milder disorders such as individuals suffering from generalized anxiety disorder, depression, or phobia, reduction of symptoms is associated with an improvement in the quality of life. But when we look at individuals suffering from severe mental disorders such as schizophrenia, reduction of symptoms may not be associated with an improvement in the quality of life. So many patients suffer from negative symptoms such as disinterest and lack of motivation to do work or to interact with people. So rehabilitation is required to help such patients to have a self-sufficient life or to help them become a productive member of the society. So in rehabilitation, the patients are given occupational therapy, social skills training, cognitive retraining, vocational therapy. So in occupational therapy, it provides an opportunity for the individual to practice and enhance skills that can be helpful in their everyday life, such as candle making, paper bag making, and weaving to help them to form a work discipline. Then comes social skills training. It is a type of behavior therapy used to improve social skills in people with mental disorders or developmental disorders, taught individually or it can be taught even in the form of a group. It is often used as one component of a combined treatment program. So this social skills training helps the patient to develop interpersonal skills through role play, imitation, and instruction. Then comes cognitive retraining. It is a program of regular activities to improve one's cognitive abilities. It can be referred to individually, like helping them towards their working memory, attention, and executive functions. Then comes the vocational therapy. After the patient improves sufficiently in all the above mentioned therapy, vocational training or a therapy is given to them where the patient is helped to gain skills necessary to undertake productive employment. So with this, we come to the end of our explanation for chapter 5.